brave है।
Now see this condition and tell me what is the diagnosis. So here you can notice that affected breast is massively enlarged. So can you see? The affected breast is massively enlarged and this is a spot diagnosis. This is what? Phyllodes tumor, also known as cystosarcoma phyllodes, also known as serocystic disease of Brody. So what's the name of this condition? This is Phyllodes tumor. Clear? What are the other names of this Phyllodes tumor? It is also known as cystosarcoma phyllodes. Cystosarcoma phyllodes. The other name is serocystic disease of Brody. Serocystic disease of Brody. Okay. How to remember? It's very easy to remember. Just break it. So if you're going to break it, can you see? There is cyst. It's a type of sarcoma. And on cut section, there is leaf-like appearance. So it's a type of sarcoma. Generally, sarcomas are solid, but this is having cystic areas also. And on cut section, there is leaf-like appearance. Now see the basic thing. Carcinomas are having epithelial origin. Sarcomas are having mesenchymal origin. Okay. But what is the thing? This is sarcoma. But the unique thing about this tumor is that it is having biphasic proliferation of mesenchymal origin. Okay. But what is the thing? This is sarcoma. But the unique thing about this tumor is that it is having biphasic proliferation of both mammary epithelium as well as connective. But the unique thing about this tumor is that it is having biphasic proliferation of both mammary epithelium as well as connective tissue or stroma. Second, we discussed that what was the most common route of spread in carcinoma breast, which is adenocarcinoma, lymphatic, and this is a type of sarcoma. So here exclusive. Second, we discussed that what was the most common route of spread in carcinoma breast, which is adenocarcinoma, lymphatic, and this is a type of sarcoma. So here exclusively hematogenous spread is seen. Lymphatic spread is not seen. Clear? So see the important points. So it is characterized by biphasic proliferation. Biphasic proliferation of both mammary epithelium and connective tissue or stroma. Okay. It can be benign, it can be borderline or malignant. Now questions are asked in pathology also. Okay. So we discussed that on cut section, leaf-like appearance is there. That's why the name is phyllodes. And what kind of stroma is seen? Monoclonal stroma. So on cut section, there is leaf-like appearance. And these tumors have monoclonal stroma. What you notice here in the tumor, that the tumor is having very rapid growth and affected breast is massively enlarged. Now see, imagine that this is the breast. Okay, here, this is the tumor. What is the feature of cystosarcoma phyllodes? That this tumor is not going to involve nipple, not going to involve breast skin, and it is not going to involve the chest wall. So if it is not going to involve nipple, in this case you will not find nipple retraction, deviation, ulceration. There is no involvement of breast skin. That's why there is no fixity to breast skin, and there is no involvement of chest wall. That's why the tumor is mobile over chest wall. This was an image-based question in latest exam. No nipple retraction, deviation, ulceration, no skin fixity, no fixity to chest wall. But problem, inside the tumor, there is hemorrhage and necrosis. and there is massive enlargement or rapid growth of the tumor. Because of hemorrhage and necrosis, there are cystic areas. One point. Second, because of rapid growth of tumor, the overlying skin remains stretched. So that's why it can lead to pressure atrophy or pressure necrosis. So there can be pressure atrophy or pressure necrosis because of rapid growth of tumor. Because of hemorrhage and necrosis, you will notice what? That there are cystic areas. And because of hemorrhage and necrosis beneath the skin in the tumor, you can notice that there is variegate appearance of skin, means multicolored skin. Okay, so what are the clinical findings? Here, affected breast is massively enlarged. So there is massively enlarged breast because of rapid growth of tumor. First. Second, there can be pressure atrophy of overlying skin. So pressure atrophy of overlying skin. And what is the appearance of tumor? If you can see, it is bosselated. Have you seen lipoma? So lipoma is having bosselated surface. So here, there is bosselated appearance. Okay? It's mobile over chest wall. Mobile over chest wall. And nipple appears normal. Means there is no nipple retraction, deviation, or ulceration. So no nipple retraction, deviation, or ulceration. These are the findings. What is the most common route of spread? Hematogenous. Lymphatic spread is not seen. And if lymphatic spread is not seen, there is no lymph node metastasis. So axillary lymph nodes are not involved. Because of hematogenous spread, what is the most common site of metastasis? Yes, it's the lungs. So the route of spread, like sarcoma, the route of spread is exclusively hematogenous. Exclusively hematogenous. It means lymphatic spread is not seen. And because of this hematogenous spread, the most common site of metastasis, like other sarcomas, is what? Lungs. Okay. And in sarcomas, how we make the diagnosis? We make the diagnosis by biopsy. So here also, how we make the diagnosis? Investigation of choice for diagnosis, and that's biopsy. Clear? Now coming to the treatment. We discussed that the tumor can be benign, borderline, or malignant. This question was asked in JIPMER. If patient is having benign appearing cystosarcoma phyllodes, so like any other sarcoma, what we perform? Wide local excision with 2 cm margin. And if it's malignant appearing cystosarcoma phyllodes, in that case we have to go forward simple mastectomy. MRM should be done or not? MRM should not be done. Why? Because in MRM we are going to remove level 1 and level 2 lymph node. Since there is no lymph node metastasis, that's why we don't go for MRM. Okay. So see the management. If patient is having benign appearing cystosarcoma phyllodes, for this we go for wide local excision with 2 cm margin. Simple. And if the patient is having malignant appearing cystosarcoma phyllodes, we go for simple mastectomy. Clear? You have to remember that modified radical mastectomy should not be done in cystosarcoma phyllodes because there is no lymph node involvement, there is no lymphatic spread. Because in sarcomas there is no lymphatic spread, but there are exceptions. There are 6 sarcomas which are having lymphatic spread, so there is lymph node metastasis, and in these sarcomas
Phylloides. Phylloides is a rare tumor in the breast. It's a fast-growing lump or swelling in the connective tissue in the breast. It shows a leaf-like pattern of cells. That's why it's called phylloides, Greek for leaf. Phylloides tumors are most commonly found in women aged 40 and over. Through self-examination, a lump or a hard spot can be felt in your breast, or during a breast cancer screening, an anomaly can be seen on a scan. The doctor will then refer you to a breast clinic where a mammogram is made, an X-ray of your breast, which is often followed by an ultrasound scan as well. During the ultrasound scan, the doctor will take a biopsy. This is done under local anesthesia. A hollow needle is used to take a sample of breast tissue. A pathologist then examines the tumor tissue under a microscope to make the diagnosis. Phylloides tumors are always treated with surgery. Lumpectomy, better known as breast-conserving surgery, is most used. The aim of the surgery is to remove the entire tumor with a margin of healthy breast tissue around it. It's important to have a clear margin of healthy tissue when the tumor is removed. Any cells remaining may be the cause of recurrence in the future. A pathologist examines the tissue to classify the type of phylloides. There are 3 different types: benign, borderline, or malignant. In all 3 types, there's a chance of recurrence. If the tumor is malignant, it may spread through the bloodstream to the lungs. Radiation therapy may be advised in addition to surgery. This happens mainly in the case of a malignant phylloides tumor, or when a recurrence of the tumor occurs. The survival rate of phylloides is excellent. Regular checkups during the first few years of treatment.
In this picmonic, we'll describe phylloides tumors, which are benign stromal tumors of the breast, and we do so with this scene of the older woman enjoying herself in a hot tub, wearing floaties. Remember, phylloides tumor, floaties. These tumors are rarely reported in younger adults, and the majority occur in women, commonly presenting in patients in their 40s, illustrated here with a 40-ounce bottle, with a median age of presentation being between 42 to 45 years of age. Phylloides tumors are typically detected as a large, palpable mass on the breast, depicted as the large paw prints. These tumors grow very fast, and they may clinically correlate with a history of rapid enlargement over a short period of time after initial detection. Now, the majority of these tumors are benign, shown as the benign bunny, but can rarely, in about 10 to 15% of cases, be malignant, pictured here as the rare steak from the malignant man. Interestingly, despite their proclivity towards being benign, all forms of phylloides tumors are considered low-grade tumors, the low grade on the test with tumor. Now, the majority of these tumors are benign, shown as the benign bunny, but can rarely, in about 10 to 15% of cases, be malignant, pictured here as the rare steak from the malignant man. Interestingly, despite their proclivity towards being benign, all forms of phylloides tumors are considered low-grade tumors, the low grade on the test with tumor stamp. And this is because even histologically benign-appearing tumors may display malignant behavior. These tumors are named from the Greek word phyllon, which translates to leaf because on histology these tumors are known for having leaf-like projections, represented here by the leaf. On microscopy, they appear as hypercellular stroma with cleft-like spaces lined by epithelium, justifying their classification as stromal tumors. Seen microscopy, they appear as hypercellular stroma with cleft-like spaces lined by epithelium, justifying their classification as stromal tumors. Seen here as the straw man. Because phylloides tumors have a small potential for malignancy, definitive treatment for these tumors is wide resection, the wide surgeon with wide resection, leaving large 1 to 2 centimeter margins. Let's quickly review phylloides tumors. These are most commonly seen in patients in their 40s and are initially detected as a large palpable mass of the breast. They're typically benign, but in rare cases may be malignant. Because even histologically benign-appearing phylloides tumors may have malignant behavior, they are considered low-grade tumors. Histologically, phylloides tumors display leaf-like projections, and because they show hypercellular stroma, they are classified as stromal tumors. These are treated with wide resection as they have a small potential for malignancy.
Yeah, I wear floaties, but I'm still an OG, sipping on a 40, can't get these paws off me. Bunnies in my hot tub, giving me a boob rub, malignant man slipping me up that red rub.
For the rest of the story, check out picmonic.com and sign up for a free account. There, you can also take Picmonic's quiz. The quiz automatically sets up your daily quiz by using spaced repetition algorithms based on the questions you've missed or struggled with to make sure you study with.
Hello friends, welcome to a new lecture today. I would like to discuss about phyllodes tumor. In this lecture, I would like to discuss about phyllodes tumor, or it is also called as cystosarcoma phyllodes. It is also called as cystosarcoma phyllodes, or it can also be called as serocystic disease of Brody. It is called as phyllodes tumor or cystosarcoma phyllodes or serocystic disease of Brody. So, this can be a benign condition and which will progress to a metastatic tumor. It can be a benign condition progressing to metastatic tumor. It can have different grades. It can be a low grade to high grade. If it's a malignant, it can spread to lung or bone. Metastatic tumor can spread to lung or bone. Then it can even be malignant and then malignant, and it can be metastatic. Grossly, if you see, the tumor which is there, that is large and it is encapsulated and there is cystic spaces inside. The tumor which is there, that is large, encapsulated, and it has cystic spaces. Even cut surface, you see many cystic spaces and it is soft. And how do you see microscopically? Microscopically, you will see that there are many cystic spaces with leaf-like projections. You will see that there are cystic spaces which look like leaf-like projections, and that is the reason why it is called as phyllodes. What is the phyllodes literally means that it is leaf. So because it has large cystic spaces with leaf-like projection, it is called as phyllodes tumor. And in the phyllodes tumor, you will see that the cells which are there, these cells are hypercellular and pleomorphic. Okay, it has cells which are hypercellular and pleomorphic. So this is about the Phyllodes tumor pathology. Now, what are the clinical features that you see in this Phyllodes tumor? So the main clinical features are, it is most common. This tumor is unilateral, it's mostly unilateral, and it will attain a large size that it shows bosselated appearance also. The swelling which is there, that is smooth, and it is non-tender skin. There is necrosis of the skin can be seen, and there is ulceration of the skin, because if you see the tumor is so big, if you see in cross section, if this is the skin, the tumor which is there, that is so big that it will compress the skin and it cause pressure necrosis of the skin. Okay, so the skin which is there, that is red and stretched, and even you can see the dilated veins over the skin. Over the skin you can see the dilated veins. The tumor, if you compare the temperature of the tumor looks warmer, and remember, it is not fixed to the skin or the deeper structures. There is no retraction, and mostly
छाती के गांठों का एक और कारण है फाइलॉइड्स ट्यूमर। ठीक है, ये जो फाइलॉइड्स ट्यूमर है, ये आप कह सकते हैं ये फाइब्रो एडेनोमा और कैंसर के बीच की बीमारी है। ठीक है, ना तो ये पूरी तरीके से बिनाइन है, नॉन कैंसरस है, ना ये पूरी तरीके से कैंसर की तरीके से बिहेव करती है। इसकी डायग्नोसिस भी जैसे मैंने आपको बताया, एग्जामिनेशन, हिस्ट्री एंड अल्ट्रासाउंड और सुई की जांच के द्वारा बनती है। जब इसकी डायग्नोसिस बनती है, सारे फाइलॉइड्स ट्यूमर के अंदर सर्जरी अनिवार्य है। सर्जरी के बिना हम इसको ट्रीट नहीं कर सकते, कोई भी दवाइयां नहीं है इसको ट्रीट करने की। इनफैक्ट फाइब्रो एडेनोमा को भी ठीक करने की कोई